Okay, I'd like to call the meeting to order. Ready?
You're the chair?
She's the chair. I am the chair. You don't know how to chair. What, you haven't been to the meetings? Is this your first time? Is this your first time?
Yeah.
Okay. On our agenda, we have 4 resolutions. And we'll start with Resolution 326.
Can we-
Oh, we had the minutes from last.
And do we have any citizen communication, Jamie?
No, we do not.
So you can
Approval of the minutes of February 5th. Do we have any discussion?
Move to approve.
Second.
Okay.
Discussion. Oh, you're good.
Any questions? And if not, all in favor say aye.
Aye.
Any against? 4-0 against. Okay. Resolution 32610. Resolution accepting a donation from Friends of Williamson County Animal Center and appropriating and amending the 2025-26 Animal Center budget by $8,000, revenues to come from donations.
Move to approve.
Second.
This is a donation Friends gives every year. This is for the purchase of Royal Canin mother and baby food, which is a specific food that's easy on their tummies for nursing puppies and kids and mothers.
Thank you. Any questions? All in favor say aye.
Aye.
Any against? 4-0 against.
Yeah, Madam Chair, Clifford is running about 4 minutes behind. He's asked if we consider his resolution at the end of the docket, if that's all right.
Which one is which?
The next one.
Next one.
Yep.
That one. Okay, we can do that. Resolution 32628. Resolution accepting a donation from Cindy and Mark Enderly and appropriating and amending the 2025-26 Animal Center budget by $50,000 for revenues to come from donations.
Move to approve.
Second.
This is a donation, obviously, from the Enderleys. They have been very generous with us. They give a sizable donation every year, and this year we're going to use it to go towards. Last month I talked to you guys about the Access to Care clinic. This will be, until that's fully operational, this will help offset the grant funds that we received to provide emergency care for folks in lieu of surrendering their animal.
Got it. Any questions? Okay, all in favor of 32628, say aye.
Aye.
Any against? 4-0 against. Resolution 32629. Resolution authorizing an amendment. Wait, it says late file. Does that mean should I ask for objections or anything?
No, that's late file on the commission.
Resolution authorizing an amendment to the opioid abatement service provider agreement with the 21st District Recovery Court and appropriating funds for additional services, appropriations to come from opioid abatement funds. Do I have a motion?
Move to approve.
Second.
Okay.
I can speak on this. This is a project that the 21st District Recovery Court applied to the opioid task force about. This is for, they have acquired a new property that they are going to renovate into. They're taking their current office, going to move it into this property, and going to convert their current office into more recovery housing. So that is what these funds are for. That's also why it's late filed, is because they had to acquire the property before they could apply.
Any questions or comments? Okay, so all in favor say aye.
Aye.
Any against? 4-0 against. And And that comes to our last resolution, 32624. A resolution of the Williamson County Board of Commissioners requesting amendment of the Tennessee Code annotated related to the authority of the Commissioner of the Tennessee Department of Environment and Conservation to contract with counties for regulation of subsurface sewage disposal system.
Move for approval.
Second.
Thank you. You want to speak on this?
Sure. Yeah, I'll ask Chrissy also to speak to it. She did some legal research. If I can open
Yeah,
the,
Chrissy spoke at the budget meetings.
can you hear me or do I need to go up there?
If you don't mind, recording.
I knew she was going to tell you that. I was trying to.
Good? Okay. So this resolution is follow-up to the septic regulation resolution that we had approved to establish the task force to look at our septic regulations. Part of the issue we found is that this body and no elected official in the county has oversight over septic regulations. The department can propose regulations to the county's Board of Health, and if the Board of Health appoints it or approves it, it becomes a regulation. The Board of Health is not elected, it's an appointed body. So what we did was ask council to do some research into ways that would allow the county commission to have some approval of regulations before they go into effect, some oversight of regulations. And what we found is that the statute only allows the Department of Environment and Conservation to contract with a local health department or Board of Health. And so what this proposal would do would be to ask our legislature to add another option to that statute to allow TDEC to contract with county government or Department of Health or Board of Health. And in that way, we would have the opportunity to choose whether we wanted TDEC to contract with us as the county commission. And that way, a lot of the process could stay the same. The department can submit their recommendations to the Board of Health. The Board of Health can recommend approval or rejection, and then it comes to us for final approval before it impacts our citizens. If you think about zoning regulations, that happens the same way. The department or the planning commission will make recommendations for zoning changes, then it comes to us before we approve it. And when we think about the impact from these septic regulations, it's pretty enormous what has been put on our citizens. When the average cost of a septic system across the state is somewhere around the $10,000 to $20,000 range, in our county, it's more like 80 to 100 when you consider the regulatory hurdles and then the cost of the systems that we require. The task force is doing a good job of reducing that. I'm optimistic that a lot of those problems will be solved, but this is a change to ensure that doesn't get away from us again. It gives us some oversight. I'd invite council to answer any legal questions about it.
She's like, you did a good job.
Madam Chair, I have one question. One question. Is there currently like a bill to, or are we going to be able to get something on the docket for this general?
There's a chance that there's a caption that would allow it. And I think if we signaled to our delegation that we'd like to see it happen, they'd probably scratch a little bit harder and see if we can fit it in. If not, we can do it next year.
Okay.
Not super urgent to make it in this session, but
Okay.
while we're working on it, we might as well just go ahead and keep the momentum and get all the boxes checked. And if they can fit it this year, great. If not, we'll have it well prepared for filing in the next session.
Okay, that was my second question. So what the impact is if we don't get it in to this session, we should still be able to take the recommendations from the task force and still get those implemented this year.
Plus, I mean, we haven't necessarily convinced everybody in the commission that they want responsibility for it. This just gives them the choice.
Right. And then we will ultimately get to vote on whether we want to take that authority and use it. But we need the legislature to open that option to us so we can make that decision.
Have you talked to any of the delegates about this?
Yeah, they're all seemingly supportive of it. They were supportive of the resolutions that we've done. They're supportive, and I'm not going to speak for them, of course, ask them, but they've been supportive of the work of the task force, the conversations happening in the community. I think they'd support this.
Any other questions? No? Okay, so all in favor of 32624, say aye.
Aye.
Any against? 440 against. Do we have any other business to discuss?
Move to adjourn.
All right, let's go. Adjourn.